Dr. Tam here, your pain specialist and chiropractor here in Vacaville, California, where every single week I want to bring you tips on how to improve your health function and longevity. Today, we want to talk about what is idiopathic pain, idiopathic pathologies like idiopathic neuropathy, right? The definition of idiopathic means they don't know. No one knows what's really going on. Okay, idiopathic kind of sounds like another word, idiot, doesn't it? Except idiopathic is actually a medical term where, imagine if you have pain. Well, if you were diagnosed with idiopathic pain, that means they have no idea and no clue why you're having the pain. There's one of these similar diseases that was named a symptom, and it's called fibromyalgia. Now, when you talk to people about fibromyalgia, or when you have been diagnosed with fibromyalgia, when you look up what fibromyalgia actually is, fibromyalgia is diagnosed when you have between 10 to 14 points of areas in your body, along your extremities, along your body, where it's positive for pain, soreness, achiness. And when you have multiple areas, automatically you get diagnosed with fibromyalgia, okay? Or that becomes an easy diagnosis. I feel like personally that when someone doesn't dig a little bit deeper on what the real problem is, you get really a not so good diagnosis, or you don't actually go get a diagnosis, because how many times have patients walk out of a doctor's office not really understanding the problem that they have, or they walk out and by the time they leave, they don't really know any more than when they walk in. And that's why so many people ends up going on the WebMD, searching on Google to find out what's really going on with their symptoms, because there's been countless times where people go to the doctors and they find out even more information on their own. So, for example, when you look at how diseases happen in the body, you got to look back at a book, the Book of Physiology, made in 1920 by Guyton, and it was stated that nearly all diseases stem from inflammation. Okay, so when nearly all diseases stem from inflammation, well, pain is the same way. See, so when someone has neuropathy, tingling going down their legs, pain going into their arms and hands, your body doesn't automatically get that for no reason. And I want to share that with you. So many people, when they get diagnosed with idiopathic pain, they think that it's in their head, or their nurse or doctor, someone told them that, oh, you know what, it's all in your head. Or, you know what, I couldn't find anything. All right, they've ran all the blood tests. They've done all of the MRIs, CT scans, taking x-rays. And they get told, no, I don't think it's that. Well, then you walk out more confused than when you walk in. You walked in thinking you wanted an answer. But if they never took the time to look at everything, well, or the concept of it is wrong, you walk out even more confused. And depression sets in, anxiety sets in, because medical doctors now are telling you that, well, we couldn't find anything. So then you start thinking, well, is it all in your head? Right? Countless times we have patients that come into our office that tell me their doctors didn't find anything. I've even read reports, and this is how ridiculous sometimes it gets, where the patient said the doctor told them there wasn't anything wrong. Yet I read the report and there were bulging disc herniations. And I said, what did the doctor tell you about this? Well, they said that at my age, that's normal. And I said, well, that's not correct, right? Because when someone tells you or finds a problem, but then yet tells you that it's normal, I will hope that to a lot of people out there, that in itself should not be normal, right? The diagnosis, it should not be normal. That wasn't a normal diagnosis, right? So I do urge everyone, first of all, in terms of inflammation, you have to look at what you are putting into your body as well. You got to put the right stuff into your body. We had a patient yesterday that came in congestive heart failure, okay? Lungs are failing. She's functioning at about 30% lung capacity. And she has sores going down her legs, these open wounds. Her leg is bright red, open wounds. Comes in, her doctor says, maybe you have neuropathy, maybe you have tingling sensations down your leg. And she came into our office hoping to get some answers, hoping to get help. And I told her, I said, what you're experiencing is something that is systemic. I said, your doctor really has to figure out what's going on with your heart, what's going on with your lungs, right? Why you're getting all the sores that you're getting throughout your body. It's not just nerve pain. The doctor said maybe it's just nerve pain. Nerve pain doesn't cause open wounds for no reason. Her leg is bright red. Part of the reason why her leg is bright red, and her doctor even told her she's not getting the right amount of blood supply. When you don't get the right amount of your blood supply, your skin starts to deteriorate, and it's so much easier for you to get a bruise, get an open wound, a sore, an ulcer in those areas. And no one knows what to do. They've ran her on the test. Yeah, you have heart failure, lung failure. I said, what did they tell you to do besides take medications? She says, oh, they didn't tell me anything. And it was a few things that I told her. I said, did your doctors ever tell you, did anyone ever tell you maybe to cut out certain foods? She said, no. They said, just eat anything. I said, anything? I said, when you're eating just anything, you're literally inflaming your whole body. I said, the first thing you should do is cut out refined sugars, okay, and refined carbohydrates. I said that the cookies, muffins, pasta, pancakes, you have to start cutting that out of your system, okay, because that causes inflammation. And she said, oh, okay, no one told me about that. Every morning I have pancake, bacons, and eggs. I said, okay, that's all wrong, right? Well, maybe the bacon and eggs, if they're high quality, but the pancakes got to go. And I said, the second thing is you got to cut out dairy. Her husband looks at her and says, dairy, she drinks like a gallon, half a gallon of milk every single day. She lives on milk. She said there are times where she doesn't eat and she would drink milk. And I said, milk is a top 8 allergen in food allergies. I said, it's not the best for you, okay? A lot of times it can cause more problems. There's a lot of sugar in milk. I said, cut that out. And she said, okay, I'll do that. And the third thing is, I said, you have to make sure you're getting the right amount of supplements, okay? So multivitamins, okay, supplements, you got to take these. She said, oh, okay, I'll take that. And I said, the last thing is, you have to make sure that you're not intaking any vegetable oil, hydrogenated oils, canola. You don't want to cook with those oils. And she said, okay, those are the 3 things. And I write them down, and I told her one more time. So, overall, when you look at the body and health, there's so many key things that we are missing, okay, as a society. And it's not that she wanted help. You can see that her and her husband really, really wanted the help. But the doctors did all the scans and everything and told her that there was nothing wrong. And I said, your body, you're living on an oxygen tank, okay? Your heart's failing, your lungs are failing. You can't walk down the hall without turning on your oxygen tank. This is not okay. There's a problem here. It's not idiopathic. Your heart and lungs just don't, fail for no reason. I said, is it genetics? Did they say? They said, no, it's just failing. They don't know why it's wrong. No one in my problem has heart problems, right? They can't figure it out. And I said, at least do the basics, right? That's what we have to do, is at least do that. Learn 3 things, okay? 3 things you have to look at. All 3 are so important. This is almost like the triune of life. If you look at a triangle, right? You need all 3 corners to work correctly, right? So number 1 is you have to look at your physical health. Second, you have to look at your emotional and mental health. They're tied in together. And then number 3 is your chemical health, right? The basics on there is physical health You got to be active. Okay? Your body's got to be in good alignment, right? You've got to have, your muscles have to work. You see? Posture's got to be good. That's all physical, right? So, the alignment, the disc space, all of that, all physical. When you look at the emotional and mental, look at your life. What's causing you an immense amount of stress throughout your life? How do you deal with it? Or do you cut it out away from your life, right? And is it jobs, sometimes relationships? I know there's kids, right? If you have to deal with it, well, you also need the downtime so your body can actually recover from it, okay? You have to make sure you're doing that, right? Mental and emotional stability and health is so important. Then there's the chemical side, right? What are you eating? What are you putting onto your body, right? And it's more than, the air we breathe, the water we drink, the foods we eat, the chemicals we put onto our body, right? We had a conversation with a mom the other day on sunblock. As easy as, not easy, but as simple as sunblock. Summer's coming and people are asking me, Dr. Tam, what's the best sunblock that you can use? And, you look at that, well, there's chemical sunblock and there's physical sunblock. Chemical sunblock can cause more problems because it's a chemical. You absorb it into your body. It prevents your body from having that burn sensation, but your skin is still getting damaged at the same time. So I told her to use a natural physical sunblock. The only difference is with a chemical sunblock, it doesn't show, but a physical sunblock, it leaves a layer of sheen on you, kind of like a light white layer on your skin, because it's actually physically blocking UV rays. And I said that's going to be healthier for you and your family because there's no extra chemicals going into your body, right? So, you got to look at everything. I mean, I look to the point where you have to look at the detergent that you use. What is in the chemical in the detergents that you use? Some people get rashes and irritation, right? And not knowing that they switch shampoos, they switch lotion, they switch soap, they switch the detergents. So you have to look at everything in your life. And I believe that as a doctor, we should be at least sharing the basics with our patients. Yes, there are problems that can come up that will take a lot more to diagnose. But if we don't even have the basics correctly on how to take care of our physical, emotional, mental, and chemical health of our body, then the rest won't even follow, won't even go right. It's, imagine you have a car, you don't do your oil changes, you don't align your car, your tire pressure is in all the wrong places, right? One tire pressure is high, the other one's it's low. You're not putting on the right gas for your car, right? So if you're not even doing the simple basic things, when a problem arises, of course you don't know what can happen. But yet, we take better care of our cars than we do our bodies. Treat your body like the last car you're ever going to have. And I promise you, you're going to look at your life and your body a little different. All right, until next time, Dr. Tam here. Have a great day.